Hello.
We will wait for another 2 minutes. We have still one person who is missing, so I'll come back in 2 minutes. Okay. So we will begin. Good afternoon, everybody, from a very sunny UNESCO Paris, and welcome to this fourth webinar against racism and discrimination in the time of COVID-19, always through a social and human sciences lens. My name is Anna Maria Mylov, and I am the acting chief of the Inclusion and Rights section. As you maybe know by now, the webinar series is organized by UNESCO and the International Coalition of Inclusive and Sustainable Cities. That is a network that was launched by UNESCO back in 2004. And today we have more than 500 member cities all around the world. The aim of the webinar is really to understand and identify practices and actions that the cities have taken, especially in favor of the most disadvantaged and the vulnerable groups. And today we are lucky enough to have 3 speakers from different walks of life. We have Tendayi Achiume, who is the United Nations Special Rapporteur on contemporary forms of racial discrimination, xenophobia, and related intolerance. We have Mr. Gwangju Shin, who is the Senior Advisor for Human Rights and International Affairs in the city of Gwangju in South Korea. And we have Jedwab, who is the President and CEO, Association of Canadian Studies in Canada. And the session will be moderated by our dear colleague, Jana El-Baba from the UNESCO office in Cairo. Just let me remind you about the other sessions that are coming up in May. They will be posted on UNESCO's website. Hopefully you will find the link in the comments box on this page. We are going to organize thematic sessions in various areas such as indigenous people, gender equality, disability, ethics and human rights, slave route, and many, many more. I will stop here. I wish you a very successful webinar, and I will give the floor to Jana. Over to you. Thank you.
Thank you very much, Anna Maria. Good day to all. I'm really happy to be moderating this 4th edition of the international webinar addressing racism, discrimination, and exclusion in time of COVID-19. We have really a very distinguished panel of experts with us today who will be sharing with us their perspectives on the social dimensions of this unprecedented, I guess, global pandemic, and also the measures to address the crisis. So the way this webinar will proceed is that we will give each panelist around 15 minutes, followed by a question and answer session. Participants will be able to post their questions in writing in the Q&A tab at the bottom of their screen. So without further ado, we will start with our first panelist, Professor Gyonggu Shin, Senior Advisor for Human Rights and International Affairs from the city of Gwangju, Republic of Korea. Mr. Shin, please, the floor is yours. Mr. Shin, you will need to unmute.
Thank you for the invitation. I have been teaching at the university, but I retired several years ago. And then I began to also work for the Gwangju International Center 10 years ago as a volunteer. And then I am now also working for the City Hall as an advisor. So this is the map where I am now. Gwangju, located in south of South Korea. Is the screen okay with you?
Yes, we can see very well.
Oh, I see. Good then. What I want to talk about today is how Korea handled the pandemic, briefly in outline. Then I want to share with you what it connotates in terms of human rights. So the first slide, in terms of per capita health expenditure, Korea here is located at 10th, far below US, Germany, Sweden, and then UK as well, and then Japan, below Japan. Also, when there was the ranking about countries' level of preparedness to deal with the pandemic, and then Korea ranked 9th. It was about last year's. But in terms of the COVID-19, South Korea has been doing well with lowest mortality rate, and then the number of cases has been contained well. So as of today, we had only, yesterday, we had only 4 new cases, and then those 4 cases are from other countries. So the 4 cases were found at the airport. But after, I want to briefly review what Korean government has done from the end of the last year. So in December last year, even without knowing that there is going to be an outbreak of coronavirus, they had an exercise, and then they do many other things quite quickly, including the testing kit prepared and then approved. So when they handle the pandemic there was a principle which is based on isolation and then conquering the virus. So to do that, they gave a priority to the safety of the medical personnel. And then so the patients other than coronavirus or respiratory symptoms, they all go to the usual hospital, but COVID-19 or respiratory symptoms, they are all siphoned to a special testing center and then specially prepared hospitals. This way, they guaranteed the safety of medical personnel. Also, they advised the general public to keep social distance, but there was no blockade to any other countries or to any region with a large number of outbreaks in Korea. So with the initial outbreak or explosion of the cases, Korea attracted a lot of attention from around the world because we had the highest number of patients outside China. So many international reporters came to Korea to cover Korean cases, but before we had the explosion, we were ready to handle the explosion of cases. As you saw, but when the around like at the end of February, when the explosion of the cases took place, government severely criticized by the opposition party and then press as well. And then popularity of the president and the ruling party went down with general election taking place 1 month later expected. But still, the government continued to rigorous tracing and testing of the cases. So at the early March, the coronavirus cases becoming well contained, and then international press paid attention to the Korean model. Because of the international attention, the local press began to positively cover the government policy. One of the reasons of the success, I believe, is the universal health insurance of Korea. So all government, all coronavirus cases are treated by the government with no payment, including Koreans as well as foreigners. So here you can see at the leftmost, you can see the bill. And then the bill requires about $9,000, but at the bottom, zero. This is the common bill. So no, left by the first case, and when she was leaving the hospital, she left a note. And then another foreigner left dollars, and then a letter as well, with a promise that she is going to pay several $1,000s more after going back home. So there, I want to interpret this the model in terms of human rights. First, they did quite rigorous trace and then test and then trade, so 3T policy, so which it was criticized by international media because it is an infringement of privacy. But I interpreted it is human rights friendly because of this rigorous tracing and then testing results in protection of the patients themselves and then possible carriers. So through the tracing, cases were found early enough before it becomes very severe. That's another one important factor. And then because of the rigorous tracing, we were able to give priority to the elderly as well as critical cases. While in countries, abandoned. But in Korea, the critical cases and all the patients were given priority. That's why the mortality rate in Korea became very low. This is the article I captured from the site, which says Italy doctors forced to prioritize ICU care for patients with best chance of survival. But in Korea, the least chance of survival cases were given priority. Another perspective is the political right of the people were protected. Like, so we had a national election, April 15th. So this is the picture you have. And then during the election, even the coronavirus patients, they were given special time to vote. So the centerpiece is showing the cases of the election for the coronavirus patients. And then the patients also were given, while they were in quarantine, they were given supplies, sufficient. Because of the rigorous tracing and then testing and then treating policy, there was no blockade of movement. So people enjoyed the freedom of movement, that's why there was no panic buying. While in many other countries, there was violence to implement the blockade. But nothing like this happened in Korea for the last 3 months. So for some, after reviewing the Korean model, I found some implications. The success of Korean model is mainly based on universal healthcare. Without this universal healthcare, even though it has been criticized by conservative government as a non-capitalistic, market economy based policy, but because of the national healthcare system, the Korean government efficiently handled the coronavirus pandemic. But with this outbreak of pandemic, we found that the informal workers are in danger of survival in many different ways. So we began to find that housing should not be a commodity to make money. It was less severe in Korea, but still it is a very important issue we can think about. Again, we also found that the democratic leadership is very important. So when I review the cases of many other countries, I found that the countries with more authoritarian government or populist leaders have more difficulty in handling the cases. I'm sorry to designate the names of the country here, but some other countries as well. The Korean government was successful in handling this issue so effectively because it was very much democratic leadership, and then it was strongly supported by civil society. One of the tragic experiences in Korea only 6 years ago was that there was a ferry accident. And then in that simple accident, about 300 young people drowned to death in front of the whole people through the TV, relaying that, broadcasting that tragedy. So parents witnessed their children just sinking down. It was because the authoritarian government handled it so poorly, many young people died. So in 6 years difference, we had a tragedy as well as the successful management of the pandemic. It shows the difference between authoritarian government and then democratic government. So the civil society, I believe, and then people in general as well, should fight against right-wing nationalism and then populist government. And then we also need to promote more inclusive culture, because during this pandemic experience, I found that there were many ultra-right segment of the society who try to marginalize international residents as well as the vulnerable people. And then again, when we think about private privacy, we have to think about how we hit the good balance between the protection of privacy as well as protection of the society, and then the life of more people. So in Korean cases, even though we were criticized about the violation, infringement of privacy, still we handled it quite nicely or effective way by protecting the names of the patients as well as the possible virus carriers. I would be happy to answer to your questions.
Thank you very much, Professor Shin, for this comprehensive presentation of how Korea handled this pandemic. I have actually a number of questions for you. Some are a little bit challenging, but I guess I will read all of them in transparency and leave the choice to you. Some, for example, one question from a participant from Philippines say they have concern regarding how your government, but so they're asking that personally you think that the government handled the COVID-19 situation in a good way. That's one question. Maybe I'll follow it with another. One participant asking whether or how much actually pressure can institutions like UNESCO put on governments to push for a universal income so that people can self-sustain in such situation.
May I hear your first question again?
The first question, we're asking that the person had concern actually regarding the government of Korea, and they're asking if you personally think the government handled the COVID-19 situation properly.
So at the beginning, Korean population disapproved the government handling of the coronavirus by 40%. So about 6% criticized, negative, 40% positive. But in 1 month, it changed, reversed. So now about 70% approved the government handling, about 30% disapproval. It was because it was effectively managed the patients and then contained the coronavirus, the first one. Second one, they fully protected the rights of the people. So freedom of movement, and then there was no lockdown. Only patients were isolated, but they were given a lot of support in terms of the daily provision. And then after they were released from the quarantine, all the personal information attained by the government were destroyed. So that kind of handling has been highly approved by the people, especially that approval came from outside, the international press. The second question, the universal income, which is quite a difficult issue, but the Korea has quite a lot of conflict between Liberal Party and then Conservative Party. So Conservative Party people at the beginning opposed the support, universal support, but now they agreed to provide $1,000 for each family who would, like of 4 people, they would be given $1,000 of support from the government. And the local government as well, they try to raise money to support low-income family members. Low-income family, like some local government provide $500 for each low-income family, and then they also provide other kind of support to low-income families.
Thank you. I guess there are some questions you touched upon, but I will mention them anyhow. Like one participant wants to know, so what happened to COVID-19 victims after their hospitalization?
So they are released from the hospital, but as I told you before, they were not billed at all. So testing, treatment, there is no payment for them to pay. So they are free of charge at all. And then again, but after they leave the hospital, they have to be periodically tested again. So in Korea, about 200 cases again. So new cases from the patients who were discharged from the hospital. But we assume that the viruses found are all dead. So we assume that those new cases are benign.
All right. There is also another question that how is the Korean medical system was put together in a way that it protects both foreigners and the locals equally?
So there was quite a lot of criticism from general public about the free treatment of the foreigners. But government logic was that if a foreigner carrier lives in Korea, then it can be infectious. That is the logic. So we have to treat everybody, otherwise the pandemic will not disappear. So there is no criticism about the treatment of foreigners in Korea now. So that kind of treatment was possible, as I mentioned before, because of the universal health care. So we have universal health care. They take care of all the bills of the hospital, and then the expenditure is supported by government.
I see, thank you. There were a couple of questions actually about the privacy issue of the system you've put in place, the tracing system. So they were asking, so which government agency was responsible for the tracing and how is the data protection guaranteed?
CDC, Center for Disease. So they not like police or information agency or military forces. CDC is in charge of that, but they get the help from the police and then banks as well. So because banks have the record of the credit card use, so the CDC use all the information to trace the possible carriers. And then after the patients are released from the hospital, or if the carrier has no symptom, then all the information is destroyed by the CDC. And then even the patient's name are not given. So all the patients are numbered, like Seoul 1, 2, 3, 4, Gwangju 1, 2, 3, 4. They are all named by number. So no personal information is disclosed.
I understand. Maybe there are a lot of questions, I tell you, but I will maybe conclude with one question. Actually, several participants asked about the issue of misinformation during this time, especially on social media platforms. So what did your center and the government in general address these issues of misinformation?
So I think the people as well as the international press as well, they all know that the Korean CDC has become very much transparent, even though they were severely criticized by opposition party and national press about the high number of the coronavirus cases. Still, they did not retreat. They continue to aggressively track down the cases in spite of the criticism. They were even mollified by the congressman, opposition congressman, but still they did not budge. They continue to do what they have to do. That's why they bought a lot of trust from people, from both opposition party as well as general public as well. So because of the high level of trust of CDC, the misinformation has been minimized.
Thank you very much, Mr. Shin. And I sincerely apologize from the participants. We could not address all the questions, but also to be fair to the other speakers. So if you allow me, I will actually move forward with our agenda. Our next speaker is Professor Jedwab, President and CEO of the Association of Canadian Studies, of course, in Canada. Professor Jedwab, the floor is yours.
Thank you very much for the opportunity to speak with the group. Also, let me take the opportunity to also thank my colleagues from the Canadian Commission for UNESCO for some of the support that they've offered us in terms of the initiative that we've established, which, as you can see on the first page of the screen, in terms of the description at the bottom of the first slide, we've created a COVID-19 Social Impacts Network, which I have the privilege of chairing, which includes some 40 experts from across Canada, across various disciplines. And what we've been doing is we've been supporting tracking surveys from a national polling firm in Canada that has been doing work on the social and economic dimensions of the crisis and how they're affecting various demographic groups, and monitoring that on a weekly basis, both in Canada and for comparative purposes, we've been doing polling in the United States. By virtue of that, we've been able to generate up to this point about 20 studies, which you can find on the website listed on the front page of the slide. In this presentation, I'm going to focus on some of the results as regards the impact socially and economically on newcomers and visible minorities, also described as racialized groups in various countries. And we'll share the results that we've generated thus far and some of the conclusions that we've arrived at on the basis of what we've found from the data we've compiled. I should also add before going to the first slide that an important objective for those of us who are part of that network of experts in our social research group is to advocate for greater collection of data on visible minorities, racialized communities, and newcomers. The compilation of that data by our government and several other governments has not been without its set of challenges. We've been fortunate to be working closely with our National Statistical Agency, Statistics Canada, and they, in the creation of web panels, which is a first for that agency, is going to be collecting such data. But in the sort of evolution of this crisis, it's important to be able to collect data in a very timely way and to make adjustments to questions and to results as things evolve very quickly. So with that said, if we can move to the first slide. Right. So what we've done basically is in terms of this various series of questions that we've asked on particular themes, we've been doing questions weekly on issues around government guidelines, including success of social distancing by demographic groups. We've been looking at various social indicators, issues of mental illness or mental health rather, both self-evaluated and with specific questions. We've been looking at issues of family life, isolation, alienation, etc. And we've been looking at some of the economic indicators, and to the best of our ability, we've been trying to roll them up into indexes, so we can create indexes and monitor the change or evolution that certain groups are experiencing as regards the economic outcomes and social outcomes. So this one is on the economic outcomes, and this is from the US. So, and it's the survey done April 19th, 2020, so it's a couple of weeks ago. Even though our sample size is a bit limited, it gives us a bit of a snapshot into what we're seeing by way of the economic challenges that selected demographic groups are encountering. So these are 4 groups in the US. The US uses Hispanic and Hispanic origin and race as the categories for both their census and in opinion surveys or attitudinal surveys. What you're seeing here, based on a global score, right, where we take the 4 dimensions or 4 indicators rather of the economic vulnerability index, which is your capacity to meet your financial obligations. In the question, we describe that as the ability to pay your bills on time. Whether your income has decreased since the COVID-19 crisis / contagion, your capacity to pay your mortgage or rent, and your ability to assist other family members. So this sort of gives you the scale of whether there's been negative impacts in these 4 areas. And as we see here, for groups that are Hispanic or Latino, the capacity to pay your obligations relative to the Caucasian white population as self-identified in surveys in the US shows a 20-point difference. And that's also true for the Asian or Asian American populations and the Black or African American populations. Similarly, we're also noticing substantial differences in your capacity to pay your rent or your mortgage. Not as much of a difference in terms of the perceived decrease in income, but that is going to vary according to what your income was. So I would suggest that as important as that indicator is, the other 2 indicators are perhaps a little bit more important in terms of capacity to meet financial obligations and paying a mortgage. And the final one, capacity to assist other family members, also a 10 to 15-point gap there, depending on which community you identify with, between the 3 communities that are non-white, if you like, and the white or Caucasian group as they identify themselves in the US. So the bar charts are basically rolling up the 4 categories, and you can see an important gap between the white or Caucasian population and the other 3 groups. Now, some people, I suspect, will argue that those gaps existed prior to COVID-19, and they certainly did. But what this particular survey suggests is that there may be a multiplier effect as regards those gaps. So the existing gaps may be multiplied by people's perceptions as to their capacities to meet financial obligations, whether it involves bills, rent, or assisting family members. Right? So that's not speaking to the gap, in other words. It's speaking to the perception of how the gap may have widened since the COVID-19 crisis. I just want to clarify because it's an extremely important point, because some of the arguments you'll hear in Canada and the United States and probably elsewhere is that, well, these gaps existed and we worked hard to address these gaps and we'll continue to work hard to address these gaps. But what we need to keep in mind is that we're probably going to be dealing with gaps that have widened substantially as we sort of move towards hopefully the deconfinement, as we're calling it here, or the re-entry into public life. Let's go to the next slide for Canada. So we did a similar exercise for Canada on the basis of the same 4 indicators. Rather than showing you the 4 indicators for the sake of being succinct and saving time, I'm just going to show you the sort of global economic vulnerability score as we're describing it, based on 6 groups. And what I've had to do because of the limitations of the sample sizes is to create what I call a rolling average. So a rolling average is essentially taking the samples from 3 consecutive weeks and rolling them up so I can get sufficient counts for each of those groups in order to measure the gaps with more efficacy. And again, what we're showing quite similarly and almost paradoxically is the economic vulnerability score for the white population, or what we call in Canada not invisible minority, is at 31%, right? 31 points, which is similar to that same population group in the United States. In fact, it's almost exactly the same. The gaps are a bit different, and they are in part a function of different Asian population. In Canada, we're looking at the group that defines itself as Chinese in the public opinion surveys that we've commissioned with the National Survey Company. But you can still see that by and large, the gaps with the Arabic, Black, South Asian, Latin American groups are again somewhere in the 20 point scale in terms of the difference. And again, that's the perception of how the crisis has affected the economic position of those groups. It's not their economic position per se. So existing gaps will likely be magnified as we emerge through and out of the crisis. Next. So these are both the global economic vulnerability score and what we created as a well-being score. The well-being score is a tantamount to a life stress index, if you like, which we based on 4 indicators. Those 4 indicators were the extent to which you're losing sleep, the extent to which you're anxious, the extent to which you are nervous, the extent to which you're experiencing mood swings, and the extent to which you are irritable, right? So that was our sort of global well-being or global score on well-being, although it's more of a life stress index. And we've broken it down, and we've had, to be fair on this demographic measure, substantial oversamples of immigrants and newcomers, right? We've added 800 to each of the 3 surveys that we've conducted with that oversample. So the reliability of the results is much higher than the reliability of the previous slides, which are more snapshots, although my sense is they do reflect the reality to a significant degree, especially when looking at this particular data, which has a very high reliability rate. So an economic vulnerability score, which is the one you see on your left, it's on your left, and maybe on your right, it's on my left. What you see is that newcomers, those people defined as having been in Canada for less than 5 years, their vulnerability across the 4 economic indicators that we listed earlier, right? The ability to pay bills, the issue of paying your rent or mortgage, the decrease in income, and meeting family, supporting family needs is quite substantial for newcomers. In other words, there's a significant disproportionate effect on newcomers in terms of what's happening relative to the economic consequences of COVID. And that is also true for the well-being or life stress score, where the extent to which the pressures felt, the anxiety or nervousness, and other things I've mentioned is considerably higher than it is for the either non-immigrants, that is persons born in Canada, or immigrants that have been here 5 years or more, though again, on the back to the box on the bar chart on the vulnerability, you can see some gaps there in terms of the 5 years or more versus the non-immigrant. Next, I think it's my last slide. Was that my last slide? No, there, no, 1, 2, go ahead, 1, 2, 3, that's it. So those are basically the 3 slides. I did want to mention very quickly before I take questions that I'm very pleased to be able to talk to people who are working with various cities, because cities, as I'm sure you can all appreciate, are the places where the vast majority of newcomers reside. And in the city I'm living in, Montreal, we have very high instance, relatively speaking, of fatalities or mortality, large number of cases relative to the situation in Canada. And cities are dealing with some of the key social distancing issues more so than other parts of our states or provinces in terms of issues of social distancing, in terms of issues of public transit, in terms of issues of housing, in terms of the very questions faced about how our sidewalks are constructed. 98%, we've been doing a lot of surveying on government guidelines. 98% of our population are saying they're distancing, but 65% of people are saying that someone else isn't social distancing. So the whole challenge of measuring social distancing has a particular effect in cities. We did a new survey yesterday, which we released, which you can find on our website, about public transit in terms of the whole reentry process. So a lot of people want to go back to work, but they don't want to use public transit. So the issue becomes how they get to work. And we know by and large that users of public transit are disproportionately concentrated with a lot of the migrants and a lot of the racialized communities of visible minorities. So all these things are interconnected. The economic dimensions of this are very interconnected with the life stress, right? The higher rates of economic vulnerability that you're encountering will lead to higher rates of life stress. And we've been able to demonstrate that quite effectively by using deep data analysis in the surveys we're doing. So on that note, thank you, and I'm open to questions.
Thank you very much, Professor Jedwab, for your presentation, for presenting really the latest evidence on how impacts of COVID are actually disproportionate by social groups. There are a number of questions. Let me read them to you. The first question, so on a global perspective and with greater numbers of diasporas in every country, can the question of ability to meet financial obligations be delineated further to include ability to send regular remittances to your country?
Yeah, we can actually do that measurement. Obviously, as is the case with the surveys we've constructed, I've been going out to raise the funds needed to ensure that we could get the questions that we feel are important to add to the survey. And new questions have come up and suggestions have come up from committee members and others. And so, but yeah, we most certainly can do that measurement. And in fact, just at the time of the crisis emerged, we did do a survey looking at diaspora relationships, and we had a few questions relative to perceptions about the impact of COVID. That was the very front of the contagion emerging, front at least as regards Canada, right? Because it started in other countries previously, as we know. So we haven't had a chance to look in depth at that survey, and we will at some point. But our researchers are working quite hard with our team in Canada, and we're trying to collect as much information as we can. And we've had some really good assistance from our statistical agency who's seconded some people to our organization to help us to analyze the data, but we're open to suggestions in that regard.
All right, another question, actually, I don't know if you'll be able to answer that, but a participant is asking, how could you compare the economy from your country to that in Europe? I wonder if you have data from Europe.
There is data from Europe, actually. I don't know if it's disaggregated, in the way that we've been able to do that, and that is what would be required. We've been collecting, at least one of my staff has been busy collecting every international survey and every European survey they can, and there's quite a bit of data with the objective eventually of looking at where those comparisons can be made. We're talking to some people in Mexico right now at an institute called, at Ibero, which is going to be doing some polling through a branch of that that institution, and we'll be doing some comparative work with that institution and with some American partners as well. But where the data is available, ideally you would like to have an international survey with selected demographic groups and be able to do the measurement, but that would be challenging, would require some international institution to step forward. And I suspect even if they were to do that, there are some countries, like France, for example, is one, where the ability to measure on the basis of some of these demographic identity-based groups would probably be restricted, right? I'm using a diplomatic term. And there are other countries that similarly, with sort of different approaches to measuring data, to collecting data, would make it more challenging to collect some of the information from groups on the basis of racialization or visible minority status or immigrant status, etc. So, yes, we can do that for a lot of countries, but there's some countries that would, in which it would be a bit of a challenge.
I see. A question also on your initiative, the hashtag COVID-19 Social Impacts Network. So they're asking, so how did this initiative benefit Canadian citizens? And is there a plan to keep using the platform of researchers following the pandemic?
Yeah, I think the benefit has been quite significant because we've been able to provide a lot of information in a really expeditious way to a number of government departments. And we do have support from a number of government departments based on specific needs. We've been able to, again, disaggregate by gender. We're putting a diversity lens across the type of information we're collecting. So, and we've been regularly releasing it publicly. And we have an arrangement, to be fair, with Canadian Press, which is a large, media network, to release every Monday the data. So it's getting a lot of national coverage. And by doing that, it's been, I think, contributing to the conversation and the discussion about the things that need emphasis. And so I'd like to think that, and I'm quite persuaded that the ability to generate evidence-based information about the impacts of the crisis and our capacity to communicate it effectively through the media has had a really solid impact on the way we've responded to issues. And we're getting lots of requests for data. So that's also a very good sign that interest is high, both from some provinces, from various other institutions, around a whole variety of issues.
Okay, one question also, so you talked about life stress score. So could you elaborate on how the Canadian government is addressing the stress by survivors of COVID-19 who have recovered from the virus? Recently, we conducted a survey with our members across Africa and other regions. It's very common that recovered patients are stigmatized and avoided by their communities.
Well, I can't speak for the government on this. I have the Public Health Agency of Canada is part of our network. They're there as observers, and they come address our meetings every Wednesday, which is when they're held. But we do have emergency hotlines. We do follow-up. We do have universal health care, and there's lots of supports. And we've identified mental health as a very, very important issue. In fact, Statistics Canada, with whom we are working, has done their most important initial survey work on mental health. And actually, we've got a contract with an institution in Quebec to do some work by administering something called the PHQ-9, which is a standardized test on depression. So we'll be doing that in our next survey, although we did, to be fair, we excluded the 9th question, which is about suicide. And so we only asked the first 8 questions of the PHQ-9, but we'll have the results for that next week. So we're definitely all, both Statistics Canada, the Public Health Agency, and various other organizations, very committed to measuring the life stress and the mental health impacts. And there are considerable resources in place across the proverbial board, both for people who've survived the virus and for people who are family members who are experiencing challenges associated with it. I can tell you that as in many countries in Europe and elsewhere, one of the biggest areas where the contagion has had an impact has been in long-term care facilities, right? In fact, in my home province of Quebec and Montreal, the vast majority of the fatalities have been people in long-term care facilities. And there's been lots of supports for families and others. And I can assure you about that because my mother is in one of those long-term care facilities. So I know personally that the support has been quite good in not only dealing with survivors, but also the families of victims of the contagion.
Thank you. One participant is asking actually if you have research on other vulnerable groups such as LGBTI, and is there any data on their vulnerabilities?
We're hoping to collect that. And again, you know, I've got my team out there talking to different people. In this case, we're talking to people at Department of Women and Gender Equality, WAGE, which is the Department of Canada that's tasked with looking at those particular vulnerabilities. And so we're hoping that in the next couple of weeks, we can unblock the resources that'll permit us to do the oversampling necessary to get a better indication of some of this particular challenges that those groups are facing. But again, you know, my challenge is both to, as it is for many of us, to not only collect the, you know, data and review the data and the questionnaires, and but also to go out and identify the sources for support that'll help us do that work. We have had conversations, although with people in the department. They've been particularly interested in the gender-based analysis that we've been applying to our work, which you can visit on our site, as I mentioned earlier. And if you're interested, and you can email me, and hopefully I'll be able to deal with the abundance of email and respond, because we had some more detailed analysis using a GBA lens, gender-based analysis lens, in terms of its impact, in terms of COVID impacts. And I can tell you, there are profound differences between the way women and men are dealing with the life stress dimensions of this. On the anxieties, we have questions about the extent to which people fear they'll get the virus or a family member will get it. And there are vast differences in the base of gender and age in particular, as regards the extent to which people are concerned about getting the virus. And concern about getting the virus is a very important predictor of attitudes and behaviors on a whole range of other dimensions of the crisis, whether it's social distancing. The social distancing measures are very affected by people's perception about whether the crisis has an effect on them or not. And, you know, the reality has been for some time that for a lot of people in Canada and elsewhere, the crisis was either happening from the outset, either somewhere else or to someone else, right? Till it's come closer to home. And, you know, and now, you know, we're seeing changes from week to week. And now our big measurement challenge is the whole process of re-engagement, and what are the conditions that will facilitate re-engagement for some people and not for others, based on their levels of anxiety, their work situations, the access to various services, and the reticence to use various services. So that's something we'll be monitoring increasingly as we do more tracking over the weeks to come.
All right, thank you. Maybe a quick question here. Do you have plans to conduct similar surveys in Africa?
Geez, I'd love to do that. But again, you know, it would require the resources to be put in place. Our resources are, you know, are limited to, but I don't consider them limited, but they're sort of limited to Canada and US and to Mexico. But hey, if there were a team of people that were interested in doing that, or a social impacts network looking at, you know, looking globally, a group of people who would want to join and do that, I'd be pleased to work with them. And, you know, we started the Social Impacts Network from scratch. We had to reorient our entire organization to move towards this issue. And we were able to do that reasonably seamlessly and I think reasonably well in a short period of time. And, but I do think, yeah, it would be great if we had some international collaborative group that could look into the social impacts. And we say social impacts, again, they can't be disconnected from the economic, you know, dimensions of this thing. They're all very inextricably linked or intertwined, if you like, as are some of the social determinants of health as regards the crisis as well. So, but, you know, sure, if UNESCO wants to undertake that, you know, I'm game.
Yes, that would be important given the vulnerabilities over there for sure. There are, again, a lot of questions. Maybe I will just end with this one, although it's a wider question. But so it says, from your professional point of view, how do you see the future of cities after COVID-19? What are the possible scenarios for cities in the sense of inclusion, economic resilience, and sustainability?
Wow, that's
a whole paper.
That's no small question. Well, let me answer it like this. I mean, I think cities are going to be disproportionately affected by the crisis, in part because of the social distancing issues that are more challenging in a lot of cities, and in part because of some of the sort of fault lines, intergroup relations, the vivre ensemble, the cohesion issues. They'll probably disproportionately affect cities. And there will be other issues around city relationships with other levels of government, right? We've seen in the United States, I think, a very good example of state governments and governors driving the issue, and the cities saying, well, wait a second, before you move forward and say that we're going to deconfine or lift restrictions, in cities we're not as excited about doing that because we're more affected by this, and so we've seen even the relationship between cities and other levels of government affected by this. But in terms of city recoveries, I think the big test right now will be between the people, at least I'm seeing in my polling in cities, that are ready to get out there and the people who are not ready to get back out there. And that will have a big determining impact on, the way cities are able to manage this. But cities will have to think a lot about public transit as a which is a very critical issue going forward. They'll have to think about housing issues to the extent it's within their jurisdiction. Sometimes those are shared jurisdictions, but we're going to have lots of issues around that. And the mental health crises, unless there's a vaccine in the next couple of weeks, which I greatly doubt, right, and no one's suggesting that that's going to emerge, we'll face some more serious questions around homelessness, alienation issues, isolation issues, etc. So there'll be a lot of issues that cities will need to think about, need to rethink their relationships with other orders of government as regards jurisdictional responsibilities in terms of having impacts to successfully come out of this.
Thank you very much, Professor Jedwab, for taking the time and those answers. I apologize for the questions. I haven't had the time to, but maybe we'll find a way to channel them to our panelists. Sure. I move to our third panelist, Professor Tendayi Achiume, UN Special Rapporteur on Contemporary Forms of Racial Discrimination, Xenophobia, and Related Intolerance. Professor Achiume, the floor is yours.
Thank you. Can you hear me?
Yes, we can hear you.
All right, perfect. Thank you so much to UNESCO for including this really important conversation, and thank you also to my panelists as well. I'm going to try to stick to time, and if I happen to be going over, maybe the organizers can just send me a little prompt so I don't cut into the time for questions and answers. What I thought I would do is just zoom out a little bit from where my other panelists have been and focus more on a global analysis that looks at trends, because the remit of my mandate is global as well. And so what I'll focus on is trends in racial and xenophobic discrimination in the wake of the COVID-19 pandemic. And then I'll talk about some of the drivers and then also what I see to be some necessary responses as a result. And so what we're seeing around the world is increased reports of racist and xenophobic attacks against certain racial and ethnic groups and against foreigners and those who are perceived to be foreigners. And so just a few quick examples. In the United States, there's been reports of verbal attacks, of social stigmatization, and even physical attacks against people who are presumed to be of Asian descent, or who actually are of Asian descent. And even though we know that the virus does not affect any particular racial group more than another on a genetic basis, I mean, there's definitely disparate impacts, which prior panelists have talked about and that I will talk about as well. What we're seeing is the increase in attacks that blame particular groups or individuals for the virus and associate the virus with those groups. You're seeing that in the US. A recent report that came out of Europe from the European Union's Fundamental Rights Agency also highlight similar trends in the EU, where you see people who are described as being people of Asian descent or people who identify as being of Asian descent are being denied various human rights, including things like being refused apartment rentals, access to health care. And prior to the implementation of social distancing measures, people were also experiencing discrimination in accessing restaurants and schools and other facilities like that. I'm sure many of you will have heard of the the discriminatory treatment of Africans in Gwangju in China, where people were being evicted from their residences, having their passports seized, also denied access to restaurants. And there's also reports from African countries such as Ethiopia and South Africa, where there have been reports of xenophobic attacks against foreigners, and again also increases in slurs that blame foreigners for the virus. I could go on listing examples. There are no shortage of examples from all over the world, which is unfortunate, but is the state of affairs. And just to highlight that some people are being targeted because of their ethnicity, others are being targeted because they're being presumed to be of a different ethnicity. So for example, there was a report in the newspaper here in the US where somebody who is Vietnamese was attacked in a public place, and the person who attacked him referred to as Chinese. And so it in some cases the discrimination targets individuals because of who they are. Sometimes it's because of who people think they are, and in both cases there is harm that is experienced there. In addition to these kind of prejudice-motivated attacks, you also have to pay attention to manifestations of structural or institutionalized forms of racism and xenophobia as well. And I think these have already started to come through in the earlier presentations. And I want to highlight these because under international human rights law, prohibited racial discrimination isn't just restricted to acts where somebody intentionally says, I'm attacking you because you are a Black person or because you come from a certain country. Even policies, practices that have the effect of discriminating on the basis of national origin, ethnic origin, race, even where there is no explicit prejudice, these are also considered to be prohibited racial discrimination. And so we have to pay attention to some of these structural manifestations as well. I think some of these structural manifestations were evident in the disparities that were presented by the previous speakers' research, which I found to be truly illuminating. There's examples also from the United States, for example, that point to how African Americans in this country are dying at higher rates than other groups. I was looking at some statistics. So last week in Indiana, African Americans accounted for 70% of deaths from COVID-19, and yet they only comprise 30% of the population. And so you might ask yourself, what's happening here? Why is it that certain groups, certain ethnic, racial, or national origin groups are experiencing a disproportionate effect of this virus? And as I mentioned earlier, this is not genetic. This is just reflecting the racialized nature of inequality in many different parts of the world, and how for many people in different parts of the world, different ethnic or racial designations actually serve the function of trapping people in structures of inequality that they have a difficult time moving out of. So in the United States, if you think about African Americans, they are most likely to be in low-income service sector jobs, which places them in the front lines of providing services and providing essential services, and that exposes them to greater risk of contracting the virus. But even more than that, it means that because they are more likely to be in low-income jobs, they are not in a position to be able to skip work, for example, if they are concerned about the pandemic, because livelihoods depend on that. And then even deeper, I think, is the problem of pre-existing inequalities in the healthcare system, in the housing system, that are all they all track racial and ethnic categorizations as well. And so you see that I was reading a study that was talking about, even with respect to access to health, some conditions that are pre-existing conditions for exposure to COVID-19 are also conditions that research has shown it's difficult for African Americans to get treatment for in some cases because of implicit bias within the medical system as well. And so all of this is to say that when we're thinking about the difference that race or ethnicity or national origin is playing in terms of how people are experiencing the pandemic, there are explicit manifestations, but there's also these structural forms of exclusion that are layered on top of each other and that have to be factored in as well. One of the comments, one of the questions to an earlier panelist raised, I think, a really important aspect of how we think about discrimination and exclusion in these kinds of contexts, which is the idea that we really need to take an intersectional approach to understand how even among different racial, ethnic, or national origin groups, there's going to be people within them who are subject to other forms of discrimination and subordination that put them in more vulnerable situations, whether it's sexual orientation, whether it's gender, whether it's disability status. All of these other categories or characteristics can increase the vulnerability to discrimination and to harm in this context. And so UN Women, for example, has highlighted the toll that the pandemic and pandemic responses is having on migrant women workers, for example, in different parts of the world. And so you have 8.5 million women migrant domestic workers. Most of these in the countries where they're working will be racial or ethnic minorities, and they are in essential but very low paying jobs, vulnerable jobs where they're subject to dismissal, or even if they're not subject to dismissal, they are unable case, migrant women are vulnerable in ways that require that account for their specific circumstances and the specific work conditions that they are confronting. But ultimately, on this very first point of thinking about the trends, I just want to highlight that this pandemic is not affecting all groups equally. We hear very much this talk of, it's a global pandemic, it has a leveling effect, we are all exposed. Yes, there is some truth to that, but there's also some deep untruths to that. Not everybody will come out of or is even experiencing this pandemic in the same ways. And for some groups, it's on the basis of their ethnicity, their race, their gender, categories over which they do not have control. I also want to highlight that the negative impacts when we think about racism and xenophobia in the wake of the pandemic are not only isolated to the groups that are experiencing the attacks or to the discrimination. And I want to highlight this because sometimes people think that racial discrimination, ethnic discrimination is just a problem for those groups who are experiencing, and that's definitely not the case, and we are seeing it. If you have racist, xenophobic structures in place, entire society is going to suffer because the pandemic will not restrict itself to these on a racial or an ethnic or a national origin basis. And so, for example, during the period when travel was still permitted, there were anecdotal reports of some countries and airports essentially engaging in racial profiling and deciding who they were going to stop and test or question further about where they were coming from. And typically it was people coming from Asia, or people who looked Asian, rather, shall I say. And so this was taking place even as Europe, for example, was very much an epicenter of the pandemic. And so if you're relying on people's perceived status as Asian to decide who you're going to take the temperature of and who you're going to try and determine whether you need quarantine measures, and yet there are people who are coming from other parts of the world and who are not racially specified, who are just able to come through your borders, that means that you have a public health approach that is using racial profiling in a way that fails to actually contain the virus and exposes a broader section of the population. There's also been an increase in social media platforms and in other contexts of just false information. For example, that people with darker skin are not exposed to the virus or are not at risk or are somehow immune to COVID-19. And that's just absolutely false. And that kind of misinformation, which is racially informed, can have the effect then of exposing people with darker skin to greater vulnerability and to others who are around them. And so even though I just said this pandemic is not affecting us all equally, there is a sense in which we're all in this together. And if we fail to ensure that all communities are receiving care, all communities are receiving protection, then it just undermines the protection of everybody. In the 2 minutes that I have left, I think it's 3 minutes because I started a minute late. In the 3 minutes I have left, I just want to reflect a little bit on why we're seeing the trends that we're seeing, and then also on responses. So One thing that should be evident is that the groups that are experiencing racial discrimination and xenophobic discrimination in many cases, but not all cases, in many cases are groups that are already subject to longer histories of racial and ethnic exclusion and subordination. And what we see in emergency situations is an acceleration or an augmentation of dynamics that already existed. And I gave the example of people of Asian descent or perceived Asian descent in the United States. And there's been a lot of research that has been done to show how for many Asian Americans, they feel a perpetual sense of foreignness, right? The sense that they are outsiders, even if they are born in the United States, even if they've been here for many generations, suggesting that this sense of, you know, your perceived Asian descent being a marker of foreignness that is consolidated in the period of the pandemic is something that is long-standing. I gave the example of the treatment of Black Africans in China, and there, those attacks happen in a broader context where racial stereotypes about Africans have been salient even prior to the pandemic. And so what I'm saying here is that oftentimes the discrimination will track longer histories of discrimination, even though that is not always the case. I was reading reports of Europeans, white Europeans in an African country who were being called corona, you know, they were being also associated with the virus as well. And you wouldn't think of those groups as groups that are historically marginalized in the African continent. So I don't want this to be a very broad statement. I think also we are seeing that it's not just about people's anxieties leading them to engage in racial and xenophobic discrimination. There have been examples of political leaders who are actually stoking xenophobic responses to the pandemic. And I've talked about this in other contexts, and I've been describing these kinds of actors as entrepreneurs of intolerance. And here in the US, for example, when the pandemic broke out, we had the president referring to it as the China virus. And you have these kinds of statements that have been made all over the world, which are dangerous. And the World Health Organization has said things like naming of diseases, which we think are trivial, actually affect the way that people experience the responses to the pandemic. And some people are made vulnerable by the very naming. So people will experience attacks because of the way that a disease has been named according to a region. So we have to think very carefully about the ways in which there are people who are willing to profit off of what are truly difficult circumstances. Okay, final word on responses. I would say just about all governments, if not most governments, have signed onto international human rights treaties that create obligations for them to actually take seriously problems of racial and xenophobic discrimination. And so they are required to take steps to ensure accountability for attacks, and also to address structural forms of exclusion as well. So it isn't just about thinking about how you respond to attacks against individuals. It's also thinking about how you reform healthcare systems and housing provision and some of the deeper socioeconomic structures of society in ways that are more equal and that mean that no one is left behind and that you have truly inclusive environments. But I want to say that it's not just about governments. There are other parts of society that have responsibilities here as well. I think the media needs to take responsibility for how they portray racial and ethnic and migrant and refugee groups in the pandemic context, but then also more broadly. I think it's very important to recognize that oftentimes the stereotypes that people are willing to act upon are made more legitimate by what they see in the media, by what they hear public officials talking about. And so I think there's a very important need to think about what it would mean to transform media in ways that mean that representations of racial and ethnic groups are not based on stereotypes that can be harmful in contexts like the pandemic. And then also just for individuals who themselves may not understand themselves to be impacted by racism and xenophobia, it's important to speak out and to show solidarity with these groups. You know, we're all spending a lot of time on social media. We're all in our WhatsApp groups. And, you know, oftentimes racist and xenophobic media will come through your social media that way as well. And it's important to speak out and to actually say that equality and inclusion are values that we are really committed to. I'll stop there. I have some other points in terms of response, but I realize that I've gone over my time, and I'll try and fold anything else I wanted to say into questions.
Thank you very much, Professor Achiume, for this presentation. I know there's a lot of things and a lot of questions for you. So actually, a couple of questions relate kind of to what is the UN going to do. I will combine them together. One says, are you planning to prepare a report on incidents of racism and discrimination during COVID? And another one also that how is the UN tackling racial discrimination during COVID? And how do you assess the level of cooperation with stakeholders to contain the discrimination?
So I should be clear to say that I'm the UN Special Rapporteur, but I don't work for the UN. I'm actually an independent expert who's appointed to report to them. And what this means is that I think I can probably I'm speaking as an outsider about my assessment of what the UN response is like. You know, the UN is an organization of member states, and that means that I think that the kinds of responses we're seeing are going to track the differences among those institutions. I think there's been some branches of the UN that have been really good about speaking out about the pandemic and really trying to do outreach, including UNESCO. You know, so I would count this as the kind of thing that the kind of good thing that the UN is doing. But I think there is a deeper concern that when it comes to the kinds of changes that are being made in different countries' laws in the response to the COVID pandemic, that there may be responses that don't respect human rights, and that there needs to be a stronger response within the UN to ensure that those kinds of developments don't consolidate themselves. So I see good things happening within the UN, but I also see the need for much greater action. Now, to make it more personal and to say what I'm doing, I have 2 reports that are coming out, and they're focusing specifically on emerging digital technologies and racial discrimination. And I was working on them before, but the COVID pandemic has highlighted the ways in which what is often thought of as a digital divide is exacerbating the negative effects of the pandemic as work moves online. And then in the context of border enforcement and other contexts, you're seeing emerging digital technologies that are being rolled out that in a way that's supposed to be a good response to the pandemic, but then also raises very serious concerns about surveillance, about lack of privacy in ways that affect racial and ethnic minority communities in more significant ways. So this is to say that I'm producing 2 reports that will address some of the dimensions of the COVID pandemic, and have been putting out press releases, and so have other special rapporteurs. So for those of you who are interested in human rights analysis along different themes, so I'm focusing on racism now, but there's also a special rapporteur on violence against women. There's other themes as well. There's actually a special procedures page that is devoted to reporting and human rights analysis on the COVID pandemic. So that might also be a valuable resource.
All right, another question. So would you suggest a securitization of xenophobia globally as a way to combat systematic and localized instances of xenophobia? If so, what would the rationale be in light of the strong tendencies towards nationalism? In other words, why should a country worry about equally treating minorities when current economics advocates for utilitarianism of care?
Okay, so I think this is an important question to address, because I think even if many people are not asking this question, they're thinking this question. And I actually have a very clear response. So I am opposed to securitization as a response to public health concerns, right? And by securitization, I'm taking that to mean a strengthening of borders, a militarization of borders, and a kind of making more muscular of law enforcement around migration because of concerns around COVID-19. And I think that's a mistake, because what we're dealing with is a public health crisis that shows that even attempts to shut down borders can't really stop people from moving and the disease from spreading. Now, on the economic impacts, I think it actually goes the other way. We live in in a world that is so economically interconnected that even for the economic prosperity of most countries, shutting down migration is actually not necessarily tied to better economic impacts, right? So in countries that rely on migrant labor, and there are many such countries, there's been reports from Europe about countries that are now thinking about lifting their travel bans because they're unable to harvest agricultural produce that is going to be essential and that may result in food shortages that make the situation worse. And then in countries where they have people who travel to other places to be migrant workers, the shutting down of borders has severely reduced remittances and other things that are beneficial for the countries. So I think to say reflexively that in order to come out of this crisis, we need to shut down the borders and to militarize them is short-sighted, and I think risks actually making the situation worse, including for citizens of different countries, just because we do have a world that is truly interconnected. So that would be my response on that, and I think there's a lot of important research and reports that are being written to track exactly those kinds of dynamics.
All right, maybe a last question. So how can we evaluate intersectional discrimination in this context? Which factor of discrimination weighs more and prompts other negative impacts in people's lives? In this and other fora, disability has not been addressed. A reflection of a general perception?
Yeah, so, you know, I think that addressing intersectionality, I think about this a lot. And I also think a lot about, you know, when we talk about intersectionality, what categories get prioritized, right? And you're right to point out that disability status, even though we all know that access to and enjoyment to human rights is very much affected by disability status because we live in societies that are ableist and that are tailored for people who don't have certain kinds of disabilities. I think that the way that people with disabilities fall out of an intersectional analysis just speaks to their priority within society, you know, which is that they have been placed at a very low priority, and part of the challenge is about raising that visibility. And a lot has to do with statistics and data. So the prior panelists spoke about how even making comparisons with the ones he's doing in Canada to Europe could be very difficult because of you know, the way that disaggregated data along these different categories is collected. So in Europe, my experience is that you can get fairly good data on gender. Getting data on ethnicity and race is much harder. And then on disability status, on sexual orientation, all of these, there is not sufficient data collected. So this is not going to be a solution. I don't think data is the answer to any big societal problem, but it's a part of the response. And I think it's a way that researchers and advocates can insist that groups that are otherwise marginalized and silenced are included in the analysis as well. So I think we shouldn't be aiming to think which axis is the worst. We shouldn't have an oppression Olympics. They are all bad and they all come together in very difficult ways, but we should be insisting on better accounting along all of these different categories, especially and including disability status.
All right, thank you very much, Professor Achiume. I'm conscious of the time. Again, there were a lot of questions. We will not be able to address all. We will need to close, and maybe by way of closing, I will address my just one question from me to all of you in just maybe 30 seconds for each speaker. If you can think of one or maybe two, or really the best thing that you governments or institutions have really done well, things you're proud of, you see like a positive thing that we can perhaps learn from, and because there will be other pandemics. What is the one thing, in your opinion, that we should learn from and make sure we do again in another pandemic? Maybe I will give the floor in the same order to Professor Shin. What is your one takeaway message?
I really believe in the leadership is important, democratic and transparent, long-sighted, not short-sighted. Short-sightedness, for example, the political leadership with long-sightedness is important. If they seek for short-sighted gain for themselves, then the people suffer.
Thank you.
And then we have to work together to establish democratic leadership.
Thank you, Professor Shin. Professor Jedwab?
I think in terms of messaging, what was very good about our governments is that they were able to convey to people that we're all affected by this. Because the real risk, I think, from the start is that segments of the population thought it was happening to someone else, somewhere else. Initially, it was all about happening to people who were seniors. It wasn't going to affect people under 65, only people over 65 or so forth. And I think that our government increasingly realized early that it needed to help everyone understand that they were either going to be directly affected or could affect others, could be vectors, etc. And that was a very important leadership manifestation that is crucial in fighting pandemics.
Thank you. Professor Achiume?
I think my comments actually connect very well to the previous two. I think the governments that are doing the best, and here I'm talking about the national governments that are doing the best, in some ways I think are the governments that are acting as though they are local authorities, you know. There's something about the way that cities, I think, have to respond to this pandemic that prioritizes the people who live there rather than the ideas about what it might be to be from that country or the key leading political issues that are shaping national elections and things like this. So I think governments that are treating the country as though it is filled with people who are living there rather than focusing on ideas, I think are doing the best in this pandemic.
Thank you very much again to our panelists. Thank you to our participants. I invite actually the participants to complete a Google Form questionnaire to evaluate this webinar. And again, I invite all of you also to keep an eye on our upcoming series of webinars in the month of May. Thank you very much, and I wish you all to stay safe and for this deconfinement to happen soon, and all the best.
Thank you.
Thank you. Bye-bye.
Now you hear me. Let me also take this opportunity to thank all of you from UNESCO headquarters, the three of you, and thank you also to Jana. You did a great job. And on this note, I wish you all a pleasant week. One question, we have received more than 50 questions. Can we send those to you for answer if you have time, so we can post them on our website? Would that be possible? Sure. Take the time you need. You don't have to answer all of them. Maybe we can group them in. I think that many of them were very similar. So, okay, perfect. Thank you. Have a nice evening. Bye-bye.
Bye-bye.